Before I start, I would just like to acknowledge that I am presenting from the unceded lands of the Awabakal people and pay my respects to elders past and present and acknowledge all First Nations people attending or watching online today. And I apologise I couldn't be there in person. So today I'll briefly talk about how past experiences of vaccination impacts on vaccinations today and share some strategies how we can improve vaccine equity for First Nations peoples. So my name is Kristy. I'm a Yurralurrai woman, originally from Dubbo, but I've been living and working on Awabakal country in Newcastle most of my life. This is the map of the Yurralurrai Nation, which is in northwestern New South Wales, which is where my family are from. I come from a long line of strong women, and pictured here is my great-great-great-grandmother, Granny Ellen, and this was taken in 1921. She moved to Engledoor Mission after escaping a massacre, and in the 1930s, people living on the mission in Engledoor were herded like cattle onto trucks and taken to Brewarrina. When they arrived, Granny Ellen began to dance and sing in Yurralurrai. It was believed that she may have danced to reassure her people that they were going to be safe, or ask permission to camp on the new land, or announce their arrival in proper Yurralurrai way. Whatever intentions, many saw it as a symbol of their painful journey. This story resonates with me today, and it shows the strength of my granny and all my other ancestors, yet hopes of a woman who endured so much in her 100 years life. She faced lots of racism and experienced the oppressive forces of government and authorities. Although I never met Granny Ellen, I really have a deep connection with her and strongly believe that her hopes and aspirations and struggle live within me, and she gives me hope every day. And it's within this context, over the past, present, and future, I do what I can for us as First Nations people to have a voice. And this is what future looks like, giving my two children the hope and strength for a future where their voices are heard and listened to. And it's this spiritual connection that helps me stay strong every day in the hope that we have a better future for our kids and those who are yet to come. So I work for Hunter New England Local Health District, and we cover a large geographical area. We have a population of around 962,000 people, 88 of which of those identify as Aboriginal and Torres Strait Islander. And we also have the largest Aboriginal population per local health district in New South Wales. We have 8 Aboriginal community-controlled health organisations and 8 discrete Aboriginal communities, or known as missions, with some of those communities bordering New South Wales and Queensland border, which adds some extra challenges for our work. So when we're talking about immunisation, we can't ignore the colonial history and how it's driven mistrust between First Nations peoples and the government and health authorities in general. We know that attitudes of racial superiority at the time and the quest to steal lands, our people were killed, poisoned, and stolen. And this history is particularly relevant in discussions around vaccinations. It'd be really silly and foolish for any immunisation service or other health services, for that matter, to ignore the historical legacy and influences of First Nations vaccine confidence and acceptance. So pictured here is a lock hospital, and there are more than a dozen of these across Australia, where people were removed from their homelands and medically incarcerated for treatment of venereal diseases, in which many didn't return home. And some people were subjected to unsuccessful experimentation with vaccine that used arsenic compounds. Now, these existed from the early 1900s through to the 1980s, so it wasn't that long ago. And it's these experiences that are passed down through the generations. And it's no wonder that First Nations people have mistrust in health services, and specifically around vaccinations. We know the concept of health for our people not only is about the absence of disease, but encompasses the spiritual, like I was talking about before, the cultural, social, mental, and physical aspects of well-being. And it's these cultural domains, along with the historical context, that must be understood if we're going to look at the immunisation gap. And when we're looking at the data and the health of populations, our ways of seeing and our experiences aren't often considered. So this is a population pyramid, shows the Indigenous population, who is on the left in the orange, and we have more of a significantly younger population, while the non-Indigenous population in the grey on the right have a larger middle-aged population. Now, we all know this, and these are two very different populations, demographics and distributions. So it's a wonder why we always compare the two. And we know that the needs of an older population are going to be different to the needs of a younger population. A population that's impacted by historical and ongoing colonization and systemic racism will have different health needs and determinants than that of the dominant population. So if we look to the figure on the right, it looks at the gap in life expectancy across 20 years, showing an improvement of almost 10% for Indigenous populations. But we also see there's been an improvement for the non-Indigenous population as well. So technically the gap has improves more quickly than non-Indigenous health improves. We all know vaccination plays an important role in preventing childhood disease, and we know that the COVID pandemic has impacted on all our lives. And we also saw a decline in routine childhood vaccination in many Australian communities, including First Nations children. When we're looking nationally at the vaccination coverage children, we've got almost 91% of First Nation kids aged 12 months vaccinated, almost 89% for 2-year-olds and 5-year-olds. Six of the states' territories have exceeded the 95% target, which is great. But there's still a lot more work that needs to be done around other vaccine preventable diseases too. But this just tells us that parents are not vaccine hesitant and they want their kids vaccinated. But COVID has meant that there's new challenges, issues, and barriers that we need to understand. So what's the issue? Well, government wants us to look at the immunisation gap between First Nations and non-First Nations peoples and ways to address that. It's important that we understand what the issues are. Now, what I'm going to say is nothing that you should haven't already heard, because we as First Nations health leaders have been saying what the issues are. We're rightfully so a priority population for Australia's immunisation programs, but this isn't often reflected in practice. We also see too many times that something needs to be done about the gap, that is unfair and unacceptable. But what is really being done to address the gap? We know that health system is racist, and there are culturally unsafe and inappropriate health services and health staff. And we also know there's a range of access issues that contribute to low vaccination coverage, including transport, cost of attending a medical practices, as many aren't bulk billing anymore, geographical location, outreach services being stopped with no drop-in clinics. Some areas don't have enough vaccine supply, and there's lack of First Nations people working in the health service, and the scope of practice for Aboriginal health practitioners varies across states and territories. And as I said, we know COVID's had an impact on whether people are getting decide to get vaccinated or not, with some people telling us in some studies that we've done about the feeling of being controlled, and that the legacy of being controlled and told what to do without any explanation on the reasons why has led to mistrust in government, and that this mistrust was influenced by past negative experiences and inconsistent information and misinformation. And we really should be listening to people's concerns, because many are feeling, you're telling us to trust you, but why should we after everything that you've done to us? Now, in my role, we often hear lots of excuses about why First Nations peoples aren't getting their vaccines, and some of which we've put together for you on a slide. We often hear that non-First Nations people want to engage with First Nations peoples, but don't know how to do it, or they're worried if they're going to offend or say the wrong thing. We really encourage non-First Nations people to know who the best people or person is to speak with in their local communities. Make the first visit or a couple of visits, just having a yarn and a cuppa and getting to know the people in the service and what they do, and learning about what they're doing around immunisation space, and talk about key issues together. We also hear from services that First Nations people just don't access the service. Have you tried understanding the reasonings why? The reasons could be really simple, which may mean you could make small, simple changes to the way that your service delivers to make it more accessible for people to go and get their vaccines. And another thing that we hear is that the service just doesn't have the budget to do more. We say plan for and build it into your budget and staffing profile. And if it's a priority, swap it out for your budget for something else. If getting more jabs in arms is a priority, then you should disinvest in something and reinvest in this. Immunisation against vaccine preventable diseases is widely supported by First Nations families, And it's the communities that know what the needs and priorities are, and they know how to address them. We just need policy and decision makers to listen to us. We need to reclaim self-determination using decolonising approaches to the way health system, policy and practice currently is, and give power back to First Nations communities and leaders to determine and lead solutions. But that doesn't mean we should be doing all the heavy lifting, and improving vaccine equity is everyone's business. We just know what works best for our communities. First Nations health workers are really trusted and respected in the communities that they live and work, and they should be enabled to empowered to decide what should be done, rather than non-First Nations peoples thinking or saying what's best for us. We know that the New South Wales Aboriginal Immunisation Program works well to address vaccine equity, and First Nations immunisation officers are really great at what they do to engage communities to lift the rates of First Nations children being immunised. In Hunter, New England, during COVID, where I work, we realised that dominant approaches to COVID vaccination distribution wasn't doing anything or wasn't helping our peoples getting vaccinated. So we started up our own Aboriginal Vaccination Steering Committee. And within 5 weeks of activating that committee, we saw more than 30,000 First Nations people getting vaccinated, just because we did things our way and not the white way. Families also told us that they are more likely to get their jabs in the arm by people they know and trust, and having open and supportive conversations with mob is really great to unpack issues and concerns. So this young man pictured on the right of the screen was really unsure about getting vaccinated, but the team sat down and took the time to talk to him at great length to understand his concerns, and then he ended up getting the jab. And we know the scope of practice for Aboriginal health practitioners varies, but it should be broadened so that they are trained immunisers and there's consistency across all states and territories. But we can't expect them to do it in addition to the already stretched workload, because just because we are First Nations doesn't mean we have to carry the colonial burden and load that's been created and imposed on us. We know that taking the vaccine to community works, and you will capture those that need it the most. It's really good to embed cultural governance and enable a space for First Nations people to actively participate in organisational decision making and at the project team level. And we've demonstrated in Hunter, New England, that it does work. So I've included a picture of our org chart in health protection in Hunter, New England, and we've got our public health Aboriginal team, or FAT, embedded within that structure. And a lot of the time we've just seen as a First Nations person, and often our Western skills and qualifications are often overlooked. We know how to engage with communities and navigating challenging relationships, and we're very skilled at this. We know the issues, we know the solutions, and we know how to get things done, but we're often not listened to, not trusted, and not respected. To us, it's not rocket science. But as we kept saying throughout the pandemic in my team, it must be rocket science because white people just don't get it. We know one size fits all approaches to health doesn't work. So it's time we stop asking about what the issues are and just take action and do things differently. Which makes me wonder, is the health service insane? We keep doing the same thing over and over again, expect different results. But when families aren't able to get their vaccinations on time, we blame them. And we say they're the problem, when in fact the health service is making it extremely hard for families and people to get vaccinated. So if health services don't change their approaches to immunisation services and make it easier for First Nations families, how are we going to expect to see an increase in vaccination coverage? And as stated in Australia's health report, all is not equal. The public health response is usually to do the best for the most and forget the rest. Public health needs to ensure that those people who are impacted the most receive the most support. More investment and commitment to action is needed from government and health services to change practice and implement approaches and strategies that make sense and reflect our ways of living. Otherwise, we're not going to see any improvement in the gap. First Nations culture and connection is really a great strength, but government likes to focus on the negative and point to the gaps in all health indicators. First Nations peoples are really curious and want more information. It's not that they are denying vaccinations, they just want to know more. And we aren't non-compliant. Families just want to make informed decisions. And it comes down to that trust and getting good and reliable information from people they know and trust. First Nations people shouldn't be responsible for carrying the load of the colonial project. Non-First Nations people are. So I pose to you, what are you doing to change your services to be more flexible and accessible for First Nations people? First Nations immunisation must be everyone's responsibility, and together we can improve vaccine equity for First Nations peoples. Thank you.